Here are a few takeaways from our training over the last couple of weeks regarding team safety and PPE. First, it's important that we understand a little bit about this bug that we're fighting. COVID-19 and influenza viruses kill about the same number of Americans each year. COVID-19 and influenza viruses are actually transmitted in a similar manner, but you're 54 times more likely to catch the flu than you are to catch COVID-19. Yes, the mortality rate is higher with COVID-19, but the odds of contracting it are 54 times lower. Nevertheless, it is a communicable disease, and so it's important that we're diligent in our efforts to protect ourselves and our patients. We need to be washing and sanitizing our hands between every patient interaction. Masks are to be worn whenever others are in the building, and as long as you're wearing a face shield, you don't need to change your mask between patients unless it is soiled or wet. Hair coverings and jackets are to be worn for every patient interaction. Jackets must be changed between patients when performing any procedure that produces an aerosol. Now, due to our stricter safety protocols, the experience to which our current patients have become accustomed will change. Our patients will be briefed on these changes prior to their visit in order to prevent any surprises. The changes would include our patient screening and in-office protection protocols and temporary changes to our comfort menu offerings. And then finally, HEPA air purifiers have been provided for each operatory. Let's make sure that these are running when our patients are in the chair. These air purifiers will purify and turn over the air in the operatory 4 to 5 times per hour. Now, for restorative procedures, a rubber dam or isodry has to be used during anything that produces an aerosol. These devices, when used with high volume evacuation, reduce airborne particles significantly during the procedure. And strict adherence to our standard protocol for disinfecting the operatories between patients and sterilizing instruments is a must. That's never an area that we need to cut any corners.